In 2012, a respected surgeon vanished without a trace. 5 years later, his hospital ID card was found inside a patient's abdomen, deliberately placed. Who put it there, and why? Welcome to Hidden Legends. Before we begin this gripping story of survival, medical mystery, and a desperate message hidden inside the human body, tell me in the comments where you're watching from today. Now, let's go back to that operating room in San Antonio. The scalpel hit resistance. Dr. Elena Garza had been fighting to save Victor Ramos for hours. The young man had been dumped at San Antonio Medical Center's emergency entrance by two men who vanished before questions could be asked. Now, deep in his abdomen, something hard blocked her progress. "Suction," she ordered, her voice tight. The object was encased in thick scar tissue and infection. She worked carefully, dissecting it free. When it finally came loose, she held it under the surgical lights. It was rectangular, plastic, heavy. "Clean it off," she told the nurse. As the saline washed away the biological matter, the object revealed itself. A hospital ID card, Dr. Simon Alcott, Concord Hospital, New Hampshire. The expiration date read September 2019. The photo showed a man in his late 40s wearing blue scrubs, smiling faintly behind glasses. Elena stared at it. A surgeon's ID sealed inside a patient like a time capsule. This wasn't an accident. This was a message. After stabilizing Victor, Elena immediately contacted hospital administration. Within hours, the ID was in the hands of Texas Ranger Elias Vance and being traced back to Concord Hospital in New Hampshire. The call that shattered Dr. Charlotte Alcott's world came during a pediatric surgery. The hospital administrator's face was pale as she entered the operating room. "Dr. Alcott, you need to come out now. It's about your husband." Charlotte's hands froze over the anesthesia machine. 5 years. 5 years since Simon had kissed her goodbye and driven toward Chicago. 5 years since his rental car was found abandoned, wiped completely clean. In the boardroom, the hospital CEO delivered the impossible news. "They found your husband's hospital ID card. It was found during an emergency surgery in San Antonio, Texas. Inside a patient. Inside a patient." The words made no sense. Simon was meticulous, obsessive about surgical protocols. He would never accidentally leave something inside a patient, which meant it had to be intentional. The flight to San Antonio was agonizing. Ranger Vance met Charlotte at the airport and took her directly to the hospital. In a sterile conference room, she examined the ID card through the evidence bag. "This isn't his primary ID," she said, recognition dawning. "He kept a spare in a hidden compartment in his travel briefcase." The briefcase that was never recovered. Dr. Elena Garza showed Charlotte the surgical images. "The placement was peculiar," Garza explained, pointing to the scans. "It wasn't floating freely. It was embedded near the stomach wall, positioned where it wouldn't cause immediate life-threatening complications, but would eventually cause problems. Infection, obstruction. It was guaranteed to need surgery eventually." Charlotte understood immediately. This wasn't an accident. It was a calculated message. Simon was alive, he was captive, and he had used the only tool he had left, his surgical skill, to send a signal. Victor Ramos lay in the ICU, weak and terrified. When Vance and Charlotte entered his room, his eyes widened in fear. "Victor," Vance began calmly, "we need to ask you about your previous surgery." "I don't remember anything," Victor mumbled, avoiding eye contact. Charlotte stepped forward. "Victor, the man who operated on you is my husband. He's been missing for 5 years. He left something inside you, a message. He needs our help, please." Victor stared at her, tears welling in his eyes. "They'll kill me. They'll kill my family. You don't understand. We can protect you," Vance insisted, "but you have to give us something." The fear radiating from Victor was palpable. Whoever held Simon had complete control through terror. Charlotte turned her attention to the medical evidence. If Victor wouldn't talk, maybe his body would. She requested Victor's full medical records and CT scans. In the radiology reading room, Charlotte and Dr. Garza analyzed the images. "The scarring is remarkable," Garza observed. "Whoever did this was highly skilled." They traced the surgical incisions, searching for clues, and then Charlotte saw it. "Where's his left kidney?" Garza zoomed in on the renal fossa. It was empty. "It's gone." The previous surgery wasn't a repair. It was a nephrectomy. The revelation hit like a physical blow. Victor was missing a kidney. Simon had removed it. This wasn't just kidnapping. It was organ trafficking. This explains Victor's fear," Vance said grimly. "Organ trafficking is a multi-billion-dollar industry. The people involved are ruthless." Charlotte felt sick. Simon had been forced to harvest organs. The thought of him being compelled to use his skills for such a purpose was unbearable. Charlotte focused on the medical logistics. A nephrectomy required specific equipment and drugs. She requested specialized toxicology screening on the fibrous tissue that had encased the ID card. The lab results revealed trace amounts of desflurane, a high-grade inhalation anesthetic, and rocuronium, a specific neuromuscular blocker. "This is significant," Charlotte told Vance. "Desflurane is expensive, highly regulated, and requires specialized vaporizers. This isn't a makeshift operation. It's a professional setup." They contacted the DEA to trace the supply chain of these restricted substances. After days of analyzing purchase records and distribution networks, they identified a major purchaser: Aegis Global Health, an international humanitarian medical organization. Charlotte investigated their records. On the surface, they appeared legitimate, but the numbers didn't add up. They imported large quantities of specialized anesthetics and organ transport equipment, yet their reported patient throughput was unusually low. "They're stockpiling supplies," Charlotte realized. "They're using their humanitarian status as a cover." Charlotte and Vance visited Aegis Global Health's regional office in San Antonio. The director, Miss Evelyn Reed, met them in a spacious conference room overlooking the city. "We're investigating the illicit distribution of controlled medical substances," Vance explained. "Your organization imports large quantities. We need to verify your usage records." Ms. Reed provided detailed records that appeared flawless. But Charlotte noticed something. The way Reed spoke, her precise terminology, the clinical detachment, it was the language of a surgeon. "You have a medical background, don't you?" Charlotte asked directly. "You're a doctor." Reed hesitated for a fraction of a second. "I hold a doctorate in public health. It's essential for managing an organization like Aegis." But Charlotte knew it was more than that. Reed had the demeanor of a surgeon. They left with more questions than answers. "She's lying," Charlotte said. "She's hiding something." Late that evening, Charlotte returned to check on Victor. As she approached the ICU, she noticed a commotion. Two men in orderly uniforms were arguing with the nurse, insisting they were there to transfer Victor to another facility. Charlotte examined their paperwork. It looked official, but the signatures were unfamiliar. It was a forgery. "This is not a valid authorization," Charlotte said firmly. "You need to leave now." The men's demeanor shifted instantly from impatience to aggression. One lunged at Charlotte, trying to push her aside. She twisted free and slammed her hand against the emergency alarm. The shrill sound echoed through the hallway. The men hesitated, then fled, disappearing before security arrived. The assassination attempt broke Victor's resistance. He realized silence wouldn't protect him. "I'll talk," he whispered when Charlotte and Vance returned. "Just keep me safe." Victor's confession poured out. He hadn't sold his kidney. It was taken forcibly as punishment for losing a drug shipment. "They took me to a clinic," he explained, his voice trembling. "They blindfolded me. It was a long drive into the desert, then a plane ride, maybe an hour. When I woke up, my kidney was gone." He described the facility. Sterile, like a real hospital, with high-tech equipment and armed guards everywhere. The surgeon was American, older, gray hair, glasses. He looked broken, like he was already dead inside, but his hands were steady. Charlotte felt an agonizing pang. The description matched Simon. "And the woman who runs the operation," Victor continued, his voice dropping. "They called her La Doctora." It was her, the woman from the Aegis office, Miss Reed. The name Maria Torres emerged from background checks. She was a brilliant surgeon whose medical license had been revoked 10 years ago for unethical practices. She had disappeared, until now, operating under the alias Evelyn Reed. With Victor's information and the supply chain evidence, the task force began intensive surveillance of Aegis Global Health. Intercepted communications revealed urgent activity. "They're talking about liquidating assets," an FBI analyst reported grimly. "They're shutting down the operation." The communications mentioned the primary asset, Simon. "They say he's becoming erratic, a liability. They're planning to dispose of him. They've been training a replacement. The timeline accelerated. They had hours, maybe a day, before the organization destroyed the compound and killed Simon." The task force cross-referenced Victor's fragmented memories with supply chain data and satellite imagery. They identified a cluster of anomalies in an isolated canyon system near the border. "We have infrared signatures indicating significant power consumption," Agent Miller announced, zooming in on satellite images, "and structures that don't match any public records." The images showed buildings nestled within canyon walls, partially concealed by camouflage netting. Solar arrays were visible, along with a makeshift airstrip. "There's a pipeline," Miller continued, pointing to a faint line, "access to an underground water source." This was it, the surgical compound where Simon had been held for 5 years. The mobilization was swift. A multi-agency tactical team prepared for the assault. Charlotte insisted on joining. "You need someone who understands the medical environment," she argued. "If Simon or patients are undergoing procedures, a firefight could be catastrophic. You need a doctor there." Ranger Vance reluctantly agreed. She would be embedded with tactical medics at the forward operating base. The convoy set off into the desert under cover of darkness. Charlotte rode in an armored vehicle, surrounded by armed agents, her anxiety mounting with every mile. The tactical teams moved with practiced stealth toward the compound. Charlotte watched the drone feeds from the FOB, her heart pounding. "Alpha team in position," a voice crackled over the radio. "Perimeter secured." The plan was a stealth breach: infiltrate, secure hostages, neutralize threats before the cartel could react. But as Alpha Team reached the main building, a high-pitched alarm blared across the compound. "Breach compromised!" the radio shouted. "We have contact!" "All teams, engage!" The element of surprise was lost. Floodlights blazed. Heavy gunfire erupted. Charlotte watched in horror as the thermal monitors showed chaos. The teams fought through resistance, slowly gaining ground. They breached the surface buildings, but found nothing. "The main building is clear," Alpha reported. "No sign of hostages. No sign of Torres." Then they found it. A reinforced hatch concealed beneath a false floor, an entrance to an underground facility. Before they could breach it, a woman's voice came over their secure channel. Maria Torres had hacked their frequency. "Ranger Vance, I know you're there. And I know Dr. Alcott is listening. You have trespassed and assaulted my staff. Withdraw immediately or face the consequences." A video feed activated on the FOB monitors. Charlotte's breath caught. It showed the interior of an underground surgical center. On the operating table lay a patient undergoing surgery. Standing over the patient, performing the procedure, was Simon. He looked gaunt, exhausted, his movements mechanical. And beside him stood Maria Torres, holding a handgun pressed against his temple. Armed guards were visible in the background. "As you can see," Torres said, her voice cold, We are in the middle of a delicate procedure. Any attempt to breach this facility will result in the immediate termination of the patient and Dr. Alcott." The standoff began. Vance attempted negotiations, but Torres refused to surrender. "This organ is worth millions of dollars. I will not let you jeopardize it." While Vance negotiated, Charlotte studied the video feed intensely. She analyzed the equipment, the monitors, the vital signs visible in the background. And then she saw it, a subtle fluctuation on the patient's monitor. The blood pressure was dropping, the heart rate increasing. The patient was unstable, heading toward hemodynamic collapse. "Vance," Charlotte said urgently, pointing to the monitor. "The patient is crashing. They're losing the organ." Charlotte seized the opportunity. She pressed the radio transmit button. "Torres, this is Dr. Alcott. I am an anesthesiologist. Your patient is crashing. You're losing the organ." Silence. Then Torres responded, suspicion and fear in her voice. What are you talking about?" "The patient is developing hemodynamic instability," Charlotte said authoritatively. "You can see the signs." "You're a surgeon, Torres. You know what's happening." The potential loss of millions of dollars weighed against Torres's crisis. "What do I do?" Charlotte began issuing instructions. "Increase the infusion rate of vasopressors. Norepinephrine 0.1 mics per kilo per minute. Administer calcium chloride, 1 gram slow IV push, now." Torres relayed the instructions to Simon. Charlotte watched as he complied efficiently. The patient's vitals began to stabilize, but Charlotte wasn't done. She needed a way to communicate with Simon directly. And then she remembered the coded language they had developed over years of working together during crisis situations. A private shorthand only they understood. "Torres," Charlotte said urgently, "the patient is still unstable. I need to guide Simon through a rapid sequence induction protocol." Torres hesitated, then agreed. "Do it, but quickly." Charlotte began issuing commands laden with hidden meaning. Increase oxygen flow to 10 liters. 10, their signal for immediate attention. Administer 50 milligrams of rocuronium. 50, their code for danger. Prepare for intubation, size 7 endotracheal tube. 7, their signal for action. She watched Simon closely. His eyes met the camera. Recognition flickered. He understood. The final command. Now, Simon. The Alcott maneuver. Now. The Alcott maneuver, their private code for controlled chaos, for breaking protocol to regain control. Simon reacted instantly. He ripped a major oxygen line from the anesthesia machine. High-pressure gas and volatile anesthetic erupted in the confined space, creating a thick cloud that obscured the cameras. Torres screamed. The guards were disoriented. "Breach! Breach! Breach!" The command echoed over the radio. Explosive charges detonated. The hatch blew inward. Tactical teams stormed the bunker, using the distraction to their advantage. The close-quarters fight was brief. The guards, disoriented by the gas and the sudden breach, were quickly neutralized. Torres raised her weapon but was tackled before she could fire. "Asset secured," the radio crackled. "Alcott is alive." Charlotte rushed to the medevac staging area as the teams extracted from the bunker. The helicopter approached, landing in a swirl of dust. They carried Simon out on a stretcher. Charlotte rushed forward. He was gaunt, his skin pale, his hair gray and thin, but his eyes flickered with recognition. "Charlotte," he whispered. She gripped his hand tightly. "I'm here, Simon. You're safe." She climbed into the helicopter with him as it lifted off, leaving the desert behind. Simon fell asleep, the sedative she'd administered providing temporary respite. Weeks later, Simon recovered in San Antonio Medical Center. Slowly, he began to speak about the 5 years of captivity, the kidnapping, the forced surgeries, the crushing guilt. "I didn't know if I would ever see you again," he confessed. "The ID card was my final act. I overheard Torres discussing my replacement. I knew I was going to die. I had to send a message. Victor Ramos, recovering in the same hospital, met with Simon. The encounter was emotional. As Simon recounted his captivity, Victor's anger transformed into understanding. "You saved me," Victor said. "You gave me a chance to expose them." Victor agreed to testify. The evidence from the compound was overwhelming. Maria Torres was sentenced to life in prison. The organization was dismantled. Charlotte and Simon returned to New Hampshire, seeking refuge in familiar surroundings, but their lives were irrevocably changed. Simon, struggling with profound PTSD, couldn't return to surgery. The operating room triggered flashbacks of the underground bunker. Charlotte channeled her pain into advocacy, becoming a leading voice against medical trafficking. She traveled the world, working to strengthen regulations. Years passed. The scars remained, but wounds began to heal. Simon found purpose teaching medicine, emphasizing ethical responsibilities to the next generation. They found a new rhythm, a new normal, a life defined not by the darkness of the past, but by the resilience that had brought them through it. The Alcott maneuver, once a symbol of chaos, had become a testament to their survival, a reminder that even in the darkest times, there is always hope.